very high esteem, and I am completely aware that the collective knowledge and expertise with regard to supervision in this Zoom room is profound. What I'm really doing today is talking specifically about competency-based supervision as an approach to supervision for a couple different reasons. One is APA has come out with very clear guidelines on training and supervision and in supervising, and the competency-based model is considered standard of practice. And so if you all are not necessarily familiar with the model as it is outlined, despite the fact that many, if not most of you, are doing elements of the model, I want to examine the core competence of the competency-based supervision. Secondly, I am aware, based on feedback that I get from interns, that the model in its totality is differentially applied in certain settings. And so the goal today also is to help you all identify, am I doing some of this, but not specifying it and helping the interns see that this is what we're doing? Am I not doing this, but it sounds like a really good idea, and I want to be able to implement some of these elements into my own practice of supervision? And that's really the second learning objective. And then finally, just facilitating overall professional development as a psychologist supervisor. I don't know about you all, but I don't go a year in which I don't learn something from one of my learners, right? And my colleagues and the literature. And so this really is just an opportunity for you all to have one exposure to this particular model and approach to supervision. Oops, I don't know how, oh, I do know how to go back. All right, so this is a screenshot of the cover of the text that we use in the supervision didactic for the interns. It has been the text for the last 3 years. It's part of Clinical Supervision Essentials, which is a series of small texts produced by APA that talk about the necessary elements to say that you are doing supervision in a particular model. And so this is the text that goes with competency-based supervision. There's a text for psychodynamic psychotherapy. There's a text for CBT. I think there's like 8 in totality. This text is a streamlined version of another text by Carol Fallender and Edward Shafransky, who really are the model developers and who have written the seminal texts with regard to this. There's now so I use this text with the interns. I use the larger text for supplemental information, as well as a current review of the literature, as much as any of us have time to do a comprehensive review of any literature. And I say we because when I came here in 2014, Jerry at the time was doing the supervision seminar and was gracious enough to allow me to do it with him. It was a really important opportunity for me to be able to spend time with the interns in a way that I might not have been able to do in my current role. I really, really enjoyed it. At the time, it really was almost a peer consultation model, which was not so different from where the discipline of psychology was with our understanding of what was necessary to not only be a good supervisor, but to train our learners to be good supervisors. When Jerry was no longer able to do it, I took over the seminar and wanted to get it a little more literature-based and looked to APA and APEC for some recommendation. This was the text that consistently came up and what was being used by colleagues around the country. I have done it now 3 years by myself, which is a lot of me time for the learners. And I am delighted that Peggy McLean has graciously accepted a co-leader position with me. So I'm looking really forward to having Peggy be an integral part of the didactic beginning in, I think we begin in August. So what is competency-based supervision? Well, according to the text, it is a meta-theoretical approach. Now, one of the criticisms is that it seems too focused on being evidence-based. And oftentimes people say, well, that just means that that's subterfuge for CBT. Now, that really is not the case. This is really a model that allows individuals to take other theoretical models or technical skills and put it within this framework. And how the seminar is currently designed is the first semester really is reading this text, lots of open dialogue, which was much easier when we weren't on Zoom. So I'm very excited about the prospect of COVID behaving. We can be back in the room where it happens, if you will. And so really immersing ourselves in the literature that is available with regard to this model. Then the second semester is largely focused on intern presentations in which interns pair and present either a theoretical model that is of particular interest to them or one that they anticipate practicing as they move forward, or a particular setting, and how do you apply the competency-based overarching model to that particular presentation that they are giving. And I think one of the things that's particularly interesting is that at least one, if not two presentations very often are, how do you apply this model to assessment and the training of assessment, and what does that mean? Because that so often means developing the learner with regard to technical competency, but wanting to expand that in a way that incorporates some of the other key components, which we'll talk about here in a moment. The other thing that competency-based supervision does is it very explicitly identifies the knowledge, the skills, and the attitudes that comprise clinical competence. And the reason that that is important is what it means to be a competent provider for me at ASAP looks entirely different for what it means for Sylvia to be a competent provider at CDD, or Catherine to be a competent provider at Truman. Those are the faces that I have right in front of me. But the idea here is that there are core competencies that we would want to see, much like there are core variables in common factors. In therapy, there are some common factors in what it means to be a competent provider, but setting really does define what it means to be competent. By having this explicitly identified, it really can inform learning strategies and evaluation procedures. One of the things that I think happens often is if we have a learner who about midway through or horrors later, we go, I don't know if they've got it. If we don't have this to begin with, and they don't have a very clear understanding of what their role is and what our role is, we're kind of in a bind, right? Because we can't say, okay, by this time, we expected you to be able to do these things in this way. And so anytime we can quantify what we expect of our learners, and equally important, what they expect of us, then it just leaves too much room for error and interpretation. The other thing is that it meets criterion reference competence standards, right? So it's not you will be able to do CPT. It's you will be able to do CBT based on showing this, on this, by this time. And it can be applied to all clinical subspecialties, and it can be applied to all theoretical orientations. I mean, I just gave an example from CBT, but it certainly can be applied with other kinds of evidence-based practices as well. And there's just no room for confusion. Now, why I think this is important, I think this is important for a couple of reasons. One is it really is what the APA, which whether you agree with everything APA says or not, provides our practice standards, is really the model that they would like to see as the overarching model within accredited internships. And from where I look, it really holds not only the intern accountable, but it holds us accountable too. What is my role and what can you expect of me? And if I don't meet my role, what are the ways that you can address that moving up the training chain, right? You can go to my supervisor, or you can go to the training director, because I need to hold true to what my part of the contract is as well. And we'll talk about the importance of the supervision contract here in a moment, both in relationship to how it's presented in the Shafransky and Philander texts, but also I have a couple slides which I hope to get to, but if I don't, they're very clearly at the end. Just had the opportunity, thank you, Catherine and NMPA, for providing the annual trust training recently. And Dr. Tubbs talked very clearly about the role of the supervision contract in risk mitigation. So we'll talk about that in a moment as well. So these are the keywords that I want you to be able to take away. Competency-based supervision is one approach. It's comprehensive, it's systematic, meaning in your system, and it's meta-theoretical. Okay, so doesn't matter where you are or what clinical activities you're doing, this is an approach that can be applied. Shafransky and Philander give this specific definition: involves evidence-based practice, it draws on sound theory, it uses empirically supported procedures, considers both supervisor and supervisee expertise, and it is sensitive to culture and context. Now, I think one of the strengths of the UNM training program is that historically, it has always been focused on culture and context. That has grown exponentially, I think, over the last few years, in no small part to the current leadership of the training program. But I like the fact that this is an integral part of how the definition is presented in this particular text. The other reason that I think it's important for you all to be aware of this model and versed in this model is that your interns are versed in this model. So we'll start talking about the supervision contract, and I'll get interns from some sites who go, you know, actually how we do it at X is this, you know, A, B, and C. And then I'll have somebody say, well, you know, I think this is implied, but there's no real written document. And we'll talk about why that's not very helpful for you or for the intern. Okay, questions. It's a little break. Questions at this particular moment. Just unmute, if you will, or comments or arguments. No? Okay. Also, Lindsay is manning the chat, so if you want to put it in that way, she is going to make me aware of any statements or concerns or questions that come up through there. All right.
Dr. Waldorf, I'm so sorry. I'm not really good today with Zoom. Got really bad allergies. So one comment I think is that I like about competency-based supervision is that it doesn't, like, we can have competency-based as the root, but then we can still use our style. So we can have like maybe behaviorism, CBT, whatever other perspectives can be used as the style, but you're still helping the individual to achieve at least minimal competency in specific areas. And I think I really like that component.
Yeah, I think that's a great point. And thank you, Patty, because it leads right into my next point. So I'll pay you later for moving me forward. One of the things I want to talk about are the necessary abilities on the part of the supervisor as understood by Fallender and Shafransky. Patty, am I saying her name right? Is it Philander or Fallender? Do you know?
Yeah, I actually asked her. It's like calendar, Fallender.
Okay, good. Thank you. And the reason I asked Patty is just another plug. Patty will be co-presenting with Carol Fallender coming up soon, particularly looking at this model and the element of multiculturalism and diversity. So more to come. Okay, so the first necessary ability is really talking about what Patty was just saying. How do we translate our knowledge of whatever we're doing into practice in a way that we can teach it, that we can model it, that we can encourage thinking about it? So it is what I am doing at this time in this particular setting. So these are the necessary abilities that the supervisor really has to have. The second one is critical judgment. And I think there is a nuanced difference between critical and criticism, right? And our job is to be critical, is to understand what the expectation is, to be able to discern when our learner is or is not performing that particular way, to have some idea of what might be underlying that particular intern's capacity or incapacity to be performing, and be able to view not only the intern, but view our own capacity and supervision skills in a critical way. And if it's us, if it's like, gosh, I don't seem to be able to get across what I need to get across. And then it becomes on us to get our own consultation for moving forward in a different way. Now, not surprisingly, one has to have interpersonal skills. And I think many of us can think of examples where we knew someone who was a very good clinician, but not such a good supervisor. And sometimes it is about these interpersonal skills. It's how is it that I interact with a learner compared with how I interact with a patient or a client. And so there are interpersonal skills that are required. Now, I'm not going into these in depth. If you look in the text, they talk very specifically about this. And so just in an hour, I don't have time, but I just want to give you a broad stroke of the necessary abilities that the supervisor is expected to have in order to function within this framework. The fourth one is technical skills, right? I have to be able to know how to do CPT before I try to train somebody in CPT. So I can't just have read the article on it. We have to have those skills. We have to have practiced it. If it is a certain type of EBP, we have to have had enough of our own training and had feedback on our own practice in order to be able to say, I have what it takes to train you in this particular approach. And that is very closely related to the idea of meta-competence. And so in an article in 2007, Fallender and Shafransky define meta-competence as the ability to know what one knows and what one does not know. And I think one area that we can get into difficulty in is when we are not using our own critical judgment to be aware of what the limits of our own expertise are in a particular, usually it's in a particular modality, and saying, I don't know that one well enough. If you want to do, I think you're right. I think doing ACT with this particular patient makes perfect sense. I have a familiarity with ACT. I don't think I could supervise to fidelity in that particular model. Let's see if Dr. Lindsay is willing to take that on as a secondary supervisor for this particular case. But I have to be willing to say, I don't know. And sometimes that's hard, right? I mean, I think we worry that if we say to an intern, I don't really know, do we come across as not being an expert? Do we come across as not being able to teach them anything? I think those are internal fears and angst. I think what we usually come across as modeling is, this is really good that my supervisor understands what they do and don't know, so it's okay for me to not know things as well. And then, of course, the final ability is you have to have ethical conduct. Now, I just was listening to a podcast in which a Buddhist concept of near enemies was discussed. And I thought, boy, does this have applicability to ethical conduct? Because I am pretty sure that no supervisor in this internship would ever think sleeping with my intern is a good idea. It just is, yeah. What a face, Sylvia. Sylvia's like, ooh, no, not doing it. Good to know, good to know. That is not a near enemy of ethical conduct. That's what would be considered a far enemy. The near enemy is, do I have a subset of people to my home? Do I give gifts to interns that are outside what I'm giving to my whole team, like at the holidays or something like that? Do I ask personal questions in a way that helps me be informed of who that is, or am I crossing a boundary into dual relationships? Now, this is largely related to interns. I can give an example, which I'm sure the good Dr. Lindberg knows exactly who I'm talking about. But in my own graduate program, we had a supervisor, groovy guy. Everybody loved him, thought he was just the bomb. And part of the reason for that is their lab meetings were always at a bar. And usually parties at his house resulted in some shared imbibing in cannabinoid products, right? Now, that seems like just supporting your lab to him. I found that really frightening, right? I'm pretty sure it didn't get held up to APA as standard practice in our program because we kept getting accredited. And I will point out, if you know how old I am, then you know for a fact that I was not a graduate student in March of this year. And so imbibing in cannabinoid products was also not recreational legal in this particular state. And so what looks like just building sort of rapport in this instant, I think really, really bordered on what was ethical conduct. And so I think the nuanced settings, at least for me, I really have to say, okay, is this too much? Am I being too rigid? Because I certainly can be on occasion. And so that, again, is where I think you have to go in and get consultation from your colleagues. Any thoughts, questions?
Hey, Ann, it's Marcia. I love that concept of the near enemy. Thank you for that, because I think when I have been a part of ethics issues, it is usually death by 1,000 small cuts, not somebody has done the giant, egregious, obvious thing. Yeah. And it's so easy for us in a profession where the relationship is the tool, right? To get gray about what is okay and not, and have blind spots about that. And then the other is, it's also, you kind of are alluding to, it's also mean, some things are just questionable, but sometimes it's also really understanding the other. Like if you have a culture where that's what you're doing, what you're describing, the scenario when you're in grad school where that's what's expected, but then you have someone join your group that is not part of what they feel comfortable with, you know, all of a sudden you have a diversity issue and you have a, you know, so I mean, that's probably more egregious or more obvious than some, but I just really appreciate that concept. It fits for me that people don't intentionally engage often in unethical behavior or questionable behavior, but it can occur subtly. And it's really important to talk these things through with colleagues. So thanks.
Yeah, sure. It's if you didn't hear, it's Jack Kornfield's work, and it is actually quoted in a podcast I'm listening to from Brene Brown. But yeah, I think it looks. Stop laughing, Catherine. The other thing about ethical conduct that I think bears just a reminder at this particular point, usually, unless we're really talking sociopathy, usually ethical violations occur when the supervisor, much like they occur in therapy, is under duress. And I think given the last 2 years on all of our psychological and emotional and spiritual resources, physical in some instances too, I think that's a good discussion to have with our interns as well. Okay, why is this beneficial? Well, first of all, it supports the Supervisor Alliance because it helps make training goals and learning objectives very, very clear, right? No one is confused about what needs to happen between the beginning and the ending, not the supervisor and not the intern. It also supports the development of competence by identifying what knowledge we expect an intern to have, what skills we expect, and what are the attitudes and values. And people may go, well, what does that mean? Well, in my own setting at ASAP, what that means is by the end of hopefully the first week, I don't have an intern saying that, well, alcoholics do this, right, in some grand scheme. And really understanding the nuance and valuing the individual and the fact that substance use disorders manifest tremendously differently across the lifespan and across cultures and across genders. And so attitudes and values can be understood as part of competency and should be acknowledged. It also supports both formative and cumulative assessment. And so what do we mean by that? It means that if you are competent at month 3, that's going to be different than what you look like at month 12, right? And so competence is seen as goals, as points on the journey, and with the recognition that that changes over the lifespan of the intern. And what I would say also changes across the lifespan of us as supervisors with regard to how competent we are, okay? It supports learning by identifying with specificity areas for improvement. And so, you know, somebody is not applying a particular approach, even, you know, whether it's CBT or psychodynamic or supportive, and it's not, you know, you kind of miss that there. You kind of miss that there, and it's related to these particular behaviors that I saw, which are not in line with the practice, or these are the things I didn't see, which are in line. Now, what does that mean? That means you probably need to have a way to rely on something other than self-report of your intern, whether it's tapes or live observation or co-leading sessions, whatever that looks like for you. It also supports the idea that competence is a lifelong process, right? We never get to the point of competency, we get to a point of being more competent with the potential for growth, and that requires career-long learning. And finally, it equally supports what is both professional development on the part of our learners. And again, we're talking interns this morning, but this can be equally applied to postdoctoral fellows or practicum students, whoever you have in a learning environment. Okay. I want to show you this next slide, not because I'm going to go over it in detail, but because these are the 7 domains that have been identified by APA as the domains that are part of competency-based supervision. And if you all are not familiar with it, and the reference is on the last slide, APA has guidelines for clinical supervision in health service psychology. It's not very long. It's like, I don't know, 30, 20 pages of reading with a great bibliography. And that's where these domains are talked about very specifically. You know, I'm thinking each one of those domains could be an hour-long presentation. So if you want to, Lindsay, you can do one each for the next 7 years, and then we'll be ready for the next self-study, and we'll be able to show it. I know, can you believe it? We just get 10 years and I bring up the dreaded self-study word, right? So just nothing surprising here. I just wanted to make you all aware of that. So what are the factors that influence supervision effectiveness? Well, Fallender and Shafransky really identify 3 factors that impact our effectiveness of supervisors. So one is, what are the attitudes and values that I bring to the supervision relationship? Well, the first of all is that I come to this relationship with integrity. And what that means is responsibilities are addressed, and best practices are performed, and supervision is free from violations. And that gets back to that whole the ethical discussion we just were having, right? What is a violation? That has to come based on what I know of me and my stimulus value in the room, what I know of my intern and where they are in their own life journey, as well as their own professional journey. And the violations have to be done within that contextual framework. Attitudes and values are ethical and values-based. They are constantly demonstrated and they affect the supervisee. We have to be consistent. And that's, I don't know about you, but that's pretty hard for me some days. I'm tired, or I've had too much coffee, or I've got 4 things going on simultaneously. But when I am with that intern in front of me, I have to be consistent in how I'm interacting with them. There has to be an appreciation of diversity, and it needs to be science-informed and evidence-based. And the difference between science-informed and evidence-based is a whole nother hour presentation as well, which somebody is I'm more than happy to see someone take on. But the idea is that we are trained in scientific driven models, and we have to incorporate that. Whatever our theoretical model is, we have come from institutions, whether PsyD or PhD, that believe and teach that the science is an integral part of us making a decision about what we do, right? How that's applied exactly will vary across graduate training, but it is embedded in all graduate programs, I believe, that are APA accredited. The second thing is we have to be knowledgeable, right? It has to be evidence-based, it has to be comprehensive, and this is my own particular struggle, is it has to be current. Abstracts are my friend. I so wish that I was more deeply enveloped in current literature. It's one of the reasons I learned from my interns, right? They'll say, have you read this article? And I say, I haven't, so send it to me and then let's read it and talk about it together. Because otherwise, the internship class of 2015 gets the exact same supervision as the internship class of 2023. And that's not fair. That's not fair to our supervisees. There has to be a set of skills that supervisors have. They have to have relationship skills. They have to have inquiry skills. And the way this is understood, again, by Fallender and Shafransky, is we have to be able to elicit information necessary to ensure that we have enough to adequately oversee and manage cases and develop these individuals to their fullest extent, right? And so we have to know how to elicit information from them, and it's not the same for all interns. So we can't rely just on the strategy that I happen to be most comfortable with regard to eliciting information. And this is no different than in therapy. I can ask pointed questions to my faculty client who is very psychologically savvy, and they're fine with that. And I was reminded yesterday I can ask straightforward questions to my 15-year-old fentanyl user, and she like shuts down, right? So it's not until I take an entirely different approach am I going to get that particular information that I need. And being aware of the intern in front of you and the nuance of how you are likely to gain the information necessary to ensure their growth and their own growth toward competence. And finally, they talk about this idea of learning praxis. And so in much the same as inquiry, learning praxis just identifies and recognizes that different learners learn differently. And I have to be flexible enough to provide information. So not just flexible in how I get information, but flexible enough in how I provide information to learners so that they can develop their own competence. You know, for some, they really want the article, right? They're just going to soak that up. I'm reminded of an intern we had last year before, I don't know, they all sort of blow together, who went on to an academic position. She always wanted the article. Now, the problem was she could get stuck in the article and then she wasn't in the room, right? So I also had to teach her by allowing her to shadow different people to see how they were in the room with individuals differently so that she could come to develop her own style and expertise. Okay, the components of supervision effectiveness, meta-competence, self-assessment, reflective practice, right? Just basically understanding who you are, what you bring, and how that is going to likely impact the person in front of you. I think for many, many years, individuals felt like any differences in that the supervision really was about the supervisee, right? And that as long as I knew what I was doing as far as treating patients, I'm good to go. And that is not true, right? And one of the things we're understanding, and particularly, I think, our embracing of reflective practice. So thanks to Lindsay and Raven and Rebecca for the work we're doing as an internship on that. We have to know what we don't know. I have to know that this individual is from a culture, or this individual is from a theoretical framework that I am not as familiar with. And how does that impact my effectiveness as a supervisor for them, right? Second is, what does the supervision relationship and alliance look like? I have some patients with whom there can be a level of familiarity that enhances the relationship. And I have other supervisees who that level of familiarity is uncomfortable for them. So I have to be able to know, how do I build alliance based not only on who I am, but who they are as well, all right? The third component of effective supervision is the supervision contract. In the text that we're learning, there are 9 pages of a supervisory contract. And that has to be an integral part. I know there are still some sites who don't do it in a formal fashion. I really would like to encourage us to move toward that. The one that is in the book is without a doubt very, very comprehensive, and it may be for your site and what you're doing. You don't need that level of comprehensiveness, but to have a supervision contract that is reviewed with the intern before they ever see a patient is very, very important. Again, it outlines, puts on paper, adds to clarity what their role is in this supervision relationship and this site, and what is my role. Okay. They also talk in the book with a nice graphic but I don't know how to do graphics on PowerPoint late in the week. So I'm going to give it to you verbally, but in the book, it talks about the learning cycle and the fact that it is cyclical, right? We watch the intern performs, we watch them, we reflect with them, asking them first, what did you think? How'd you think that went, right? Then we evaluate their performance, give them some assessment, give them some feedback, and then we plan for how to have them perform, and it starts all over again. And so that again reinforces one of the earlier points that supervision, competence in practice, competence in supervision is lifelong and should be continuing to grow. Okay. Oh, I just realized I clicked the wrong button. And finally, there has to be an infusion of multiculturalism and diversity. And that means we have to understand, I'm preaching to the choir here, obviously, APEC knows we got a rock star with regard to DEI right here in our own internship, but it's the client's culture, it's the supervisee's culture, and it's the supervisor's culture. And I think our understanding of all of those really has grown, I think, pretty exponentially just even in the last 3 to 5 years, right? That we talk broadly about the client culture, but certainly that wasn't even my training. Culture was, we didn't even know what we were talking about there or training graduate students in. And then we said, oh, we need to understand the patient's culture. Oh, well, maybe we need to understand the supervisor's culture. Oh, well, actually, we need to understand our own culture because there is an intersectionality of all of this. We need to be aware of personal factors. And for me, what that means, what's my stimulus value in the room? And that happens all the time in therapy. And I am very familiar. I'd like to think I'm fairly aware of that in the therapy setting. I don't know if I'm always that in the supervision setting, right? So there are those of you who are much younger than me who are really groovy, and I look like the crone, right? Now that has benefits and deficits for certain interns, and I have to be aware of my stimulus value into the room. The other component of supervision effectiveness is I have to be competent in legal, ethical standards, regulations, and professionalism. I just never feel like I know this enough by heart. The number of times I have to go back to the state statutes to review the ethical standards of APA, those change. Certainly we get thrown curveballs. What does it mean to do ethical care via telehealth? So that too is an ongoing, and that's where meta-competence I think really comes in, is what do I know, what I know or don't know, and how do I test that? And almost always that's consultation. Consistent and ongoing evaluation and feedback, that's of us, right? That's feedback from the interns, feedback from our colleagues, feedback from Lindsay, however it is that we can learn and be aware of what things we're doing well and what things consistently show up as a pattern. So I can give you an example from my own supervision. The first year I was here, I was a primary supervisor for an intern at ASAP. And I think Marcia can talk to why that is particularly challenging. I just couldn't do it, right? There were too many days that I got pulled into other things, and so that was the feedback. Really appreciated Dr. Waldorf when I could get her full attention. I learned a lot. And by the way, she's really scattered. And she was right. That intern was right. And the decision was made then to make me only a secondary supervisor, unless it's a single case, right, in a particular type of psychotherapy. The other thing that makes supervision effective is management of supervision of supervisees who don't meet competency standards. And certainly the intern handbook has a very clear outline of what that means and what that will look like. I believe that should be an integral part of the supervisory contract at each site. And then in a complete nod to our Office of Professional Wellness colleagues, the final thing that makes us effective supervisors is self-care, and not always easy to do. I want to leave the last 5 minutes for just some questioning. So I just want to quickly show you these slides. This is from a recent NMPA workshop entitled Perplexing Problems in Psychological Practice. It talks very briefly, and these slides will be made available. Alex, are we doing it via download today, or Lindsay, are you sending those out? How are you doing that?
I don't know yet.
All right.
The
slides will be available.
We will get them out, and the recording will be on, we're making a YouTube channel for the internship.
Okay. The thing I want to point out here, though, is that a clear written supervision agreement contract is important, as it is one of the major ways to mitigate risk, both to you and to the learner, right? And they go on to indicate what are the various elements that should be in the supervisory agreement. So I would encourage you to look at their 13 points, I think it is. The last one, 14 points, the last one being what should be expected from us. And then also look and see how that varies, looks different from what's in Fallender and Fallender and Shafransky, in a way that maybe you could identify a contract that is appropriate for your setting. One of the things that was a take home for me on this one was the idea that supervision is a contractual relationship. And I thought, well, God, that sounds sort of legal. What's that mean? Well, you know what? It's a little bit like marriage, right? So I say, I'm going to do this, and you say you're going to do that. And then we spend our time trying to meet those goals. It's my contract to have a job, right? So Dr. Towen says, we expect this of you, and here's what you can expect from me. And it is serious, and it should be taken at that level. Some additional resources, some I quoted, some I didn't, but just hopefully would be helpful for you when we get the slides out in whatever form we do that. And I will stop sharing. And in the last, this probably doesn't come as a surprise, but when I ran through these slides with the dogs, it didn't take nearly this long, and they didn't have many important comments either. So I apologize for pushing us right up to the edge, but would love to hear any comments or questions or arguments about this particular approach or anything that I have said today.
Thank you, Ann, for presenting first, and my apologies to your dog for having to sit through a PowerPoint presentation. Hopefully you reinforce with treats. Supervisor contracts, if there's a risk mitigation process, do they have to go through legal?
So I don't think they have been, because I think they've just been an integral part of training, and it is contractual in theory, but not in the same way as like a salary contract. But it's just the idea that I'm pledging to you this, you're pledging to me that. And I certainly know that when APA was here, there were sites that have very specific supervisor contracts, and I don't think they had any angst about the fact that it didn't have the legal stamp at the bottom.
No, not so much from the accreditation piece, but from a institutional implementation piece.
You know what? I am not aware of that, and I haven't heard that or read that in any of the literature. It might be a really important question to ask APEC to see how other institutions who use supervisor contracts respond to that.
And just so you know, Nancy, the ones that we use here are not through the hospital. They're just ASAP specific. And one of the things that I wanted to share too is that I like that through the contract, we can talk about why. So for example, we're saying you're gonna have this many hours of walk-in, or conduct so many stage 2 assessments, we talk about why would that be important for them to complete in terms of the competency. And the other thing I was going to add that I like about this model, because we are very, Rebecca and Raven are excellent when it comes to the RLP. It keeps our hotspots, us the supervisors, hotspots, blind spots in check, because we're doing it all for the sake of competency. So there might be times where, I might feel like, oh man, I totally failed this supervisee. But then if I go back to the competency perspective, then I'm thinking, okay, let's see how we can help this individual to supervisee, to get to where they need to be. And so that's another aspect that I like, both the contracts and the refocus, so I don't make it personal. I don't know if that makes any sense. I'm a little Benadryl right now.
Any other comments, questions, thoughts? Plans for the weekend, whatever. Raven's thinking.
And to follow up on the discussion about having it go through legal, I've been at a couple places that use supervision contracts, and never have we ever gone through legal or anything. It's always just been an internal document.
Okay, thanks, Dan. I just want to point out in the chat, please, in order to get CEUs for this, you have to fill out the evaluation. The link Alex has put up in the chat. You just to remind you, if you want a hard copy of the certification, you have to save it and print it out for yourself. That's not something that CBH does. All right. Well, I have gone 2 minutes into your otherwise scheduled time. Thanks so much. I appreciate it and hope it was helpful. And yeah.
Thank you.